Hi, I'm Dr. Melky. I'm going to show you today a very easy way to do the docking on the interlace. If you follow what I'm going to tell you about now, step by step, and you don't deviate from these particular steps and be very strict with them, you will be able to get a very central dock in at least 80% of cases. First, let me show you the different elements that we have here. We have the suction ring, right? The suction ring, I use it open, so we leave that open. When this is open, that means the ring is closed. When I press on it, it will open it and let the docking mechanism come in place. So this is called the PI, which is the patient interface, and it is placed on the interlace and then lowered towards the patient. When it is lowered, we do a no-touch technique. In general, you don't want to touch it. You want to leave it hanging. Why is that? Because if you touch it, you're not letting the PI fall into the path of least resistance. You just want this to be loose so that when it comes in place, it just docks where it wants to dock. And that's important so that you have a good applanation when you open it. As you do the procedure, you're going to have a cross and the ring of light. The cross and the ring of light have to be aligned, meaning the cross has to be in the middle of the ring of lights. Never go down on the interlace unless the cross and the ring of lights are aligned. If they misalign, you stop, you realign them, and then you continue coming down. So this thing is going to come down, come down, come down. As it's coming down, without touching the suction ring, you're looking from outside. You're not looking at the screen, you're not looking at anything. Once it touches, now the green light appears on the interlace, and at that point, your hand is not touching. At that point, you keep coming down, aligned all the time until you reach the yellow light. Once you see the yellow light, at that point, you're going to open. So once you open, this thing drops. It drops and applanates the cornea. You can put your finger on the temple here while you open it. That sometimes gives you additional stability. There are a few things to keep in mind. One, as you position the patient, make sure they are looking at the two ring of lights, and we ask them to look in the middle of the middle ring. That will ensure adequate centration. The other thing to always remember is to move the patient's head. See, most patients have a big nose like me. So if this is coming down, it's going to hit the nose and it's not going to give you good applanation. So don't be concerned about tilting. You can tilt your head as much as you want so that the head is tilted and this is coming down. So get into the habit of always tilting the head as you're coming down. So one thing that's very important is that when you place the suction ring, you want to place it in a way that it's decentered supranasal. All right? To do that, you have to give yourself room. So push the upper lid as much as you can towards the bone. And as you keep pressing towards the bone, you pull on the lower lid and then put the suction ring on the eye. So most fellows forget or they're a little timid about pushing the upper lid. So push the upper lid really, really hard until you touch bone. Basically, so that there's nowhere for it to go. Then you pull on the lower lid and drop it down. Once you drop it down, keep the pressure on the upper lid and give yourself room so that you can move things. Once you move your suction ring and it's in the location you want it to be, press with both hands. So you have one hand here and another finger on the suction ring and press hard, press down. And now we activate suction. Okay? If the suction does not hold, that means either the upper lid or the lower lid are stuck under your suction ring. So repeat the maneuver, make sure you pull the lids well away from you so that you can push with both hands. On occasion, you will have a patient where it's difficult to get suction. So you can push, kind of let it imprint for a few seconds before you apply the suction. So press, 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 count till 5, and then you apply suction. In some situations, it's very hard to apply suction and to get a good suction no matter what you do, because the patient has some sort of astigmatism, or the fissure is small, or they're nervous. So in those situations, don't be hesitant about using a speculum. You can put a speculum, slowly crank it out as wide as you can, and then you can do the same thing with this end. So usually we don't use a speculum, but if you have to, you have to.